Vandaag om 11:30 wil jullie iets vertellen. Het gaat over mijzelf, het is iets wat ik heb en daar zit ik best wel mee. Jullie mogen het wel weten, ik heb ADHD. Ik leerde van de dokter dat dat een stoornis is. Ik ben ermee geboren, het is een stofje dat ik mis. En daardoor ben ik vaak veel te wild en veel te druk. Ik gooi van alles om, maar dat gaat per ongeluk. Ik ben een doodgewone jongen, ik ben niet gek, ik ben niet dom, ik ben alleen te druk. Ik snap zelf niet eens waarom, dat is best vervelend, maar ik ben niet zielig. Nee, ik ben gewoon een jongen met ADHD.
Hello, I'm Dr. Gerald Chodak. Attention Deficit Hyperactivity Disorder, or ADHD, is a term many of us have probably heard before. But what does it actually mean? Simply put, ADHD is a common behavioral disorder that emerges in children before the age of 7. It can extend into adolescence and even adulthood. ADHD was first identified as a disorder in 1902. And for years, doctors believed it was the result of serious brain damage. While that theory has since been proven wrong, the precise causes of ADHD are still unknown. What we do know is that the occurrence of ADHD is closely tied to biological factors such as the size and density of various brain structures and the way chemical reactions take place within the brain. For example, scientists have discovered that children with ADHD often have a smaller cortex, the part of the brain that controls thought and action. This diminished size usually occurs in the area of the cortex known as the frontal lobe. The frontal lobe is an especially important part of the brain, playing a role in many key functions, including impulse control, socialization, reason, and judgment. Experts believe this may help explain why some children with ADHD are more prone to drifting off, making sudden outbursts, or using poor judgment. Other research into ADHD has focused on nerve tissue in different areas of the brain. It appears that in children with ADHD, this nerve tissue is smaller or sometimes thinner than in normal children of the same age. While scientists aren't yet certain as to why, they believe these variations can affect a child's attention and impulse control. In addition to the physical differences in brain structure, many experts believe that people with ADHD, like those with depression, have chemical differences as well. Some studies have shown that children with ADHD have lower amounts of the neurotransmitter dopamine in the brain. Neurotransmitters are chemical messengers that carry information to and from nerve cells. Since dopamine plays a key role in the proper functioning of the cortex, not having enough of it could interfere with cognitive processes such as focusing and attention, the very same processes that people with ADHD struggle with. And though it's still being tested, the so-called dopamine theory seems to be supported by the fact that stimulants, which are often used to treat ADHD symptoms, work by increasing dopamine levels. Scientists still don't know the exact causes of ADHD, but much progress has been made. The more they discover about the roots of the disorder, the better equipped they'll be to develop more effective methods for understanding, diagnosing, and treating this common ailment.
Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common behavioral disorders in children. In this chapter, you'll learn how to recognize the symptoms of ADHD and what criteria your doctor may use to diagnose it. The National Institute of Mental Health estimates that 2 million children in the United States have ADHD. But the disorder can be found in adults as well.
It's a disorder that starts in childhood and often continues. It can be diagnosed at any age, but the criteria specify that you have to have symptoms of ADHD as a child, actually before age 7.
So what is ADHD and how is it diagnosed? Like most behavioral disorders, there is no objective medical test, such as blood analysis or a brain scan, that can be used to determine if a child has ADHD. Instead, a diagnosis is made based on a child's behavior and whether it matches any of the textbook symptoms of ADHD. There are 3 types of ADHD: hyperactive impulsive, inattentive, and combined. Children with hyperactive impulsive ADHD frequently fidget or squirm and can't play quietly. Those with inattentive ADHD are unable to pay attention to detail and have difficulty following instructions.
If you meet criteria for both, then you have what's called combined type, which would be the classical ADHD.
The majority of children diagnosed with ADHD have combined type symptoms. One of the greatest challenges in making a diagnosis of ADHD is that many of the symptoms are actually normal behavior for most children at one time or another. But for kids with ADHD, the symptoms are so excessive and long-term that they impair learning and stunt the development of social skills.
Everyone has inattention from time to time, so they have to have symptoms that are severe, more severe than the normal person in that situation.
If a parent has a concern, a question, if they think their child might be ADHD or have a learning disability, please seek professional help.
A variety of healthcare professionals are qualified to diagnose ADHD. First, a family doctor or pediatrician will examine the child to rule out any physical conditions that might be causing the symptoms.
I'm going to take your blood pressure, you know, it doesn't hurt.
Next, the doctor or another healthcare professional will talk to the child's family and teachers to find out what symptoms the child has.
He was having a lot of problems on the bus, and he was having...
If those symptoms fall within the range of ADHD, the doctor then has to determine whether the behaviors meet the other requirements for diagnosis. First, the symptoms must have been present before the age of 7 and lasted for at least 6 months. And second, the symptoms must have significantly impaired the child's life in at least 2 separate settings.
The reason that we look for a problem in more than one area is because there is no medical test for ADHD. What you don't want to do is make a diagnosis of ADHD in a situation where there's just one particularly strict teacher, or a child maybe who's dyslexic, so has trouble in reading class but would be okay on the playground or somewhere else.
The final step in diagnosing ADHD is to eliminate other mental disorders, such as anxiety, schizophrenia, or a personality disorder, as the cause of the ADHD symptoms. Because ADHD commonly coexists with other conditions, such as learning disabilities and depression, it's important to examine a child for those as well.
Kids who have ADHD and learning disabilities, probably the same things cause both of them, only in slightly different parts of the brain. So it's not surprising you would see them together.
If you suspect your child may be suffering from ADHD, it's important to talk to your family doctor and begin seeking help. And remember, there's no reason to feel discouraged or hopeless. A child with ADHD, if diagnosed and treated properly, can go on to lead a productive and happy life.
They're resilient, they're creative, they're artistic, they're musical, they're bright, they're super intelligent, they're fantastic kids. And I tell my parents, please look for the gift in your child. Be positive about something each and every day.